Welcome to you all in the second part of the topic advantages, disadvantages, selection of candidates for controlled dosage form. Here we will specifically discuss the several advantages of a controlled dosage form may have. What are those? The advantages are improve patient convenience and compliance due to the less frequent drug administrations. Next, reducing the fluctuation in the steady state level and therefore a better control on disease condition, and reduce intensity of local and systemic side effect. Next point, increase safety margin of high potency drug due to the better control on plasma level, maximum utilization of drug enabling reductions in total amount of drug administration, reduction in the healthcare cost also. How it can be possible? By improving the therapy, shorter the treatment period, lower frequency of dosage form, and reducing the personal time to dispense and administer and monitor of patients. So these are the most important advantages a controlled dosage form may have. Therefore we are going to select controlled dosage form sometime above and or over the other conventional or sustained dosage form. Now we will discuss the disadvantages or limitations of controlled dosage form. All the limitations has pointed out here. Now first one is decrease the systemic availability in comparison to immediate release conventional dosage form. This may be due to incomplete release, increased fast metabolism, increased instability, insufficient residence time to complete the release, and pH dependent solubilities. These are the few points which actually play a hindering role in absorption of the drug or releasing of the drug as compared to conventional drug delivery systems. Now going towards the next point, poor in vivo in vitro correlation, possibility of dose dumping due to the food, physiological and formulation variable, chewing or grinding of oral formulation by the patient and thus increase the risk of toxicity. So this may happen when if we just sometime chewing the formulation, or we just crack the formulation and convert it into the powder form, then we have consumed. So this kind of problem may arise, and obviously in vitro in vivo correlations is one of the major issues in controlled drug delivery systems. Next is retrieval of the drug is difficult in case of toxicity, poisoning or hypersensitive reaction, which can be easily done by the topical formulation. However, whenever we are taking something systematically orally, it is not quite possible to make the same things done. Followed by the next point, reduce the potential for dosing adjustment of drug normally administered in various strength, and of course as is a highly sophisticated design, it actually of high cost formulation due to its designing and due to its different applicabilities, the cost of the product is get high. So these are the most common disadvantages of controlled dosage form. Now in the third part we will going to discuss about our outcome of the discussion.